My name is Ashlyn Gogan. I'm Director of Poverty Reduction with the Government of Newfoundland and Labrador, and I'm the chair for this panel. I'm really thrilled to be here. So a huge thank you to the conference organizers for inviting me, and an even bigger thank you to the people with lived experience who have been sharing their experiences today, because I think that's, in some ways, it's so important for us to keep that in mind in everything that we're talking about. I mean, that's why we're here, and it's an incredibly valuable part of today. So thank you, because I know that's a much harder thing to do sometimes, to share personal experiences, than certainly what I'm here to do today. This session is about the interaction between federal and provincial programs, services, and benefits for people with disabilities. And obviously that's in the context of facilitating people to participate in the workforce. So today we're going to be talking about both employment supports and income supports more generally, because they're equally important in thinking about how to support people and ensure that people can not only go to work but are always better off financially if they go to work. In this session, we're going to be talking a little bit about issues, but we really want to talk about solutions. So we're hoping to have a solutions-focused discussion. During the panel this morning on provincial strategies, we heard about lots of great things that are going on in a number of different provinces, the ones that were represented there today. And certainly there's great things happening. We also heard from Emile and read in the document that summarizes work that so many of us have been involved in about the problem of silos and the problem of lack of coordination between programs and benefits and supports, and lack of coordination sometimes between what provinces and territories are doing and what the federal government is doing. And that's the focus of this panel. We know to have a full impact that coordination is essential. We also know that navigating systems can be really complicated. And a big part of that is that the systems themselves are sometimes too complicated. Being successful really requires taking a person-centered approach. And taking a person-centered approach requires that we're really thinking about the experiences and how things add up for the people that these programs, services, and benefits are designed to serve. And I guess for me, as a public servant, I'm all too aware that sometimes the programs and the services and benefits that we have don't interact well. Sometimes we also create situations where people are better off financially if they don't work than if we do, and that is just terrible for everyone and an embarrassment. And that's even when there are available employment opportunities. So there's a lot more awareness about this today, particularly, I think there was always awareness, people who are experiencing it obviously, but there's a lot more awareness on the part of provincial and federal government officials, and a lot more acknowledgement of that. So that's a real cause for optimism, and I think another reason why the development of this strategy, it seems like the time is right for it. It seems like we're ready and in a position where we can bring about some change in this area, that everyone's acknowledging we need a more coordinated and holistic approach. So we need to consider and make sure that the strategy is building on experiences. And so what I'm going to do, how today is going to work, is I'm first going to ask each of the panelists to briefly introduce themselves, keeping in mind that in the materials you received there was a biography of everyone, and then I've got some questions for each of the panelists, and we're going to have some time at the end for questions.
Okay, I'm Ian Ross. I'm the Executive Director of Program and Policy Development in the Ministry, BC's Ministry of Social Development and Poverty Reduction. So I'm responsible for employment program policy, but I've also worked in social assistance and on accessibility initiatives. Those of you who are here this morning already heard this little blurb, so I will pass it along.
Hello, I'm Pam Leahy. I am a PhD candidate with McMaster University, actually defending next week. I'm also a social policy analyst, but I am sitting on this panel today as a person with lived experience. So Rebecca, if you're in the room, I don't have to think like a researcher right now.
I'm Terry Copes. I'm the Executive Director of the Sudbury Community Legal Clinic. For the past 35 years, I've been helping people access various different benefit programs, whether it be WSIB, ODSP, CPP disability, rent geared to income. So I have a fairly good grasp of how the various different benefit programs don't interact with each other very well, and the difficulties people have in navigating the system.
My name is Eppo Martins. I work at Employment and Social Development Canada, and I'm the policy director responsible for the Opportunities Fund for persons with disabilities, and also for the workforce development agreements, which I'll talk a little bit about as we go on. But that's the big transfer that includes funding as well for programs for persons with disabilities.
Good afternoon, everyone. My name is John Stapleton. I have a fellowship, an innovation fellowship with the Metcalf Foundation, which is a charitable foundation in Toronto. I have a tiny social policy consultancy called Open Policy, and I work generally as a benefit designer in social assistance programs for the province of Ontario for the better part of 30 years.
Great, thank you, everyone. The first question relates directly to something from the draft strategy. So if anyone has it in front of you, if you look at the top of page 18, the question is, what should be the goals of the strategy to improve the interface among programs? Some possibilities are to have an array of programs so that the system is client-friendly, coherent, and easy to navigate. Are these the appropriate goals? What other goals might be stated in the strategy document?
You can go first.
Okay, sorry. One of the pillars is to have a disability confident and inclusive workplace. And I think where we need to start when we talk about navigation and inclusiveness is to have a common language. And I really like the term disability confident, because I think it reframes the discourse and puts onus or more responsibility on employer engagement and less on the business case. And the business case is different depending on who you talk to, depending on what jurisdiction or sector that you're in. And often the business case, or the business case that I'm used to hearing, is that people with disabilities are super crips. So, they'll save you money, and they're loyal, they won't go anywhere, they're gonna be so grateful for a job that, they will, cost you less money. And so I think that argument is really kind of destructive because it sets people up with disabilities to fail. And so I would like to see us have a common definition for the business case. And I think that a good start is having, reframing it to be disability confident. And I think that's a good place to start with inclusivity.
Jerry, do you want to go next?
Okay. Yeah, I think the starting point for anything has to be, is the strategy going to improve the lives of those with disabilities? And it needs to be client-centric. It needs to address issues of stigma and intersectionality. And very important, it needs to provide an adequate level of income support for people. If you don't have that, you're setting yourself up for failure of any kind of program. And certainly, programs need to be complementary. Currently, they are the opposite of complementary. They act at cross purposes to each other very often. Well, I think I've taken less than 2 minutes, so.
Hi, so I just reflecting on the sort of questions that they had put to us here, and I can't say from BC's perspective that we would argue with client friendliness and or coherence or programs being easy to navigate, but I would say and I think it speaks to what we just heard, is that when people are at the center of it, I think there's reframing this more in terms of outcomes, the outcomes we want to see, broad social outcomes in terms of employment rates, labor force participation, and also surveys that would indicate how people themselves feel about their status or their situation relative to where we started. I think that's an important way. I think often is that these terms like client-friendly and coherent or complementarity are kind of thrown around. We don't measure them very well, and it would be good to develop some measures to get to a common understanding of what those are.
So I think that looking at the strategy, definitely I think the objectives and the goals of the strategy in this area around client-friendly, coherent, and easy to navigate are definitely key and on point. I think really what we want to strive for is a coherent set of programs that is very easy for clients to navigate and hopefully as close to possible to a one-stop shop as we can. Just want to maybe frame a couple of things for the discussion going forward. When we talk about complementarity of programming, there's I think a couple of different ways that we can think about it. One is complementariness between programs that provide income support and programs that provide employment supports. And I think sometimes those can certainly work at odds with one another, especially across federal and provincial jurisdictions. But then there's also, when it comes to employment programs specifically, and that's sort of more of my area of expertise, there is that question of complementarity as well in terms of providing that one-stop shop and not having to send clients to multiple different places for multiple different programs. And the more we can refer mutual clients to each other or provide a service together, the better. And then there's a question of taking it maybe up a level or down a level, depending on how you want to look at it. It's more complementarity in the program design or the policy design. And that's trying to create programs where we serve the same set of clients together, which certainly has a lot more potential for creating a seamless type of service delivery. So I'll elaborate a little bit on that as we go through some of the other questions.
My job here this afternoon is to comment on what everybody else has said, so I didn't make detailed notes. I had both the best job and the worst job. The best job because I didn't have to prepare anything, I have to listen to everyone else. And the worst job is because I got to say something coherent at the end.
Thanks, John. We have full faith in you. So the next question is, what is a concrete example of a successful initiative or promising practice related to these goals? How can we draw on this experience to move forward? So I don't know if we want to go in the same area. Pam, if you'd like to go first.
I think I don't know of a promising practice that is across jurisdictions, federal and provincial. I do know of some that are local that we can build on and build up, such as co-location of services, mental health services with employment services is one I think that is an obvious one. But one of the conversations that we've had across Canada for a long time is the definition of disability, and moving away from the medical model and looking at the whole person and wrapping supports around that person and considering their housing and considering their income security and their employment and their level of education, because without all of those things in place, their employment can't be retained. However, in Ontario, we seem to have regressed on that score. Yes, they do want to align with the federal government, and aligning is part of being a coordination, but the way they want to align is to align it with the federal definition, which is very strict, and it's actually more restrictive than it is now. So I would like to see, one of the principles I would like to see in the disability strategy, and for us to keep in mind when we're designing more accessible and inclusive programs, is do no harm. And I think we need to keep that principle in mind when we're looking at creating a aligned definition of disability. So I think I'll leave it there.
Yeah, I too cannot give you an example of a successful initiative because I don't think there are any comprehensive successful initiatives out there. There are tiny bits and pieces here and there locally. I guess the closest I can come is an actual benefit when here in Ontario, Ontario Works and the ODSP program moved to a common computer program. The one benefit for that, I don't think it was one they intended, because I think they were more looking at transferring overpayments more easily between the programs, is that it now takes a lot less time to transition from Ontario Works to ODSP, whereas we used to see about 2 months for processing a successful ODSP application onto benefits from Ontario Works. We're now seeing that to 1 month or less. So it's a tiny little step, but it's something. What we do need to look at, and things that can be done, I think, fairly easily right now, are looking at providing navigators for the system or the systems. The navigators would have to be very knowledgeable of all the different benefit programs. I think the ideal people to be navigators for the systems are basically people with lived experience, because not only do they know the systems but and have experience with them, but they also are more likely to be empathetic to the client groups and not approach anything with stigma. So I think that's a step which can be done fairly quickly and fairly easily. In terms of making programs more complementary, that is a more difficult and I think longer term objective. The difficulties between getting all the provinces and territories and federal government to act together can be quite difficult. It may have to be done on sort of a province by province basis with the federal government. And also, though, one thing that I think provincial governments need to look at, and also the federal government needs to look at, is just how they can make their own programs interact better with each other. The problem is you've got a variety of different programs under a variety of different ministries often, and they are very siloed. That, you know, the various ministries may not talk to each other. Now, this may vary from province to province, because what I've heard is some of the initiatives from some of the provinces mentioned this morning seem to be a move in the right direction. But, you know, even within ministries, there are separate programs and silos. You know, how much interaction is there between, say at ESDC, between employment insurance and CPP? They're different, even though, you know, you walk into the same Service Canada office to access the program. So that is something that needs to be looked at. Also, in implementing any of this kind of strategy, it is very, very important to have people from the client groups at the table. For any program really to be successful, it needs to be designed with the clients in mind, and the best people to say, particularly in terms of client friendliness, ease of navigation, you need to get the input from the clients at the program design stage. And just one example of some of the problems with this is the talk of use of technology for accessing programs. Oh, people can apply online, it'll be very easy, you know, it makes things easier for them. Well, sometimes the websites where you access it are a mess. It isn't easy to navigate the website. But secondly, I'd say over half of my clients don't even have a phone, much less a computer. And a lot of them are not computer literate or even literate. Accessing programs through technology is great for some people, but for others, and it's got to be remembered that a lot of the disabled community are older, and they haven't grown up with technology like the current generation has. So this is where, you know, in program design, talk to the people who are going to use it before you design it. Because one size does not fit all, and you know, it doesn't make programs accessible unless there are a variety of methods for accessing it. Also, just geographically and culturally, take those aspects into account as well in terms of accessibility of programs. You know, one-stop shopping is great, but if you don't have, if you're, say, in rural Northern Ontario, you've got no-stop shopping. So you've got to figure, how do you make programs accessible throughout the program? And one last thing is, there's talk of Passport. Passport is great, but you've got to make it also work across provincial boundaries. That's a real problem that, you know, if you move from one province to another, you lose your whatever provincial benefits you get in one province, and then you have to go and reapply in the next province, and the criteria are different. So let's get this done. Also, educate, another easy thing is educate the service providers, the government service providers, as to how the other programs work. I run into so many problems where, quote, helpful service providers give misinformation about other programs at other levels of government.
So I talked at the start about there being sort of maybe some different areas or different arenas where the question of complementarity comes out or comes up. And one of those is certainly sort of the interplay between benefits and employment programs. But when it's taking a look at employment programs specifically and employment programs in the provinces and the territories, I think there are some really good examples where we've done a good job of creating a seamless service. And I think the best example is the workforce development agreements. And I think some of you are probably aware of what those are, but just to give you a quick background, we had previously three transfers where we gave money to the provinces and territories to deliver employment programming. Those were consolidated last year into a new workforce development agreement. So they included the labor market agreement for persons with disabilities, the Canada Job Fund, and the Targeted Initiative for Older Workers. And in this new consolidated workforce development agreement, we've preserved the funding for persons with disabilities, and the provinces and territories have committed to continue to cost match our contribution as they had under the previous LMAPD, and to increase spending as their overall envelope under that new agreement increases. And I think a couple of things to keep in mind. By having an agreement where we basically give money to the provinces and territories based on some agreed principles, set out in a bilateral agreement, we basically sideswipe all of these issues of complementarity, because it's ultimately the provinces who design and deliver the programs with federal support. And the money that does go to programming for persons with disabilities under the Workforce Development Agreement is by far the largest pot of federal money that goes to supporting that population. So it's one that maybe we don't think of very often, but it is, I think, a great example of the federal government working with provinces and territories to deliver a seamless service to clients. So of course, we do continue to maintain our own employment programs as well. The federal government, for example, has the Opportunities Fund for persons with disabilities. And there, some of the challenges of complementarity do continue to arise, but we do quite, we do make efforts to address that. So for example, we have a forum of labor market ministers, which is a multilateral provincial, territorial, and federal organization where issues of complementarity are regularly discussed and addressed. We have bilateral committees with all the provinces and territories, and those are also focused in part on complementarity. And I know there's been a number of other initiatives, and I think it's great to have Ian here from BC, because I think BC, the relationship between BC and the federal government is a real example on that front. We also do complementarity workshops and ongoing discussions just to see how we can best serve clients in a coherent way. So I think there are a number of examples of success, notwithstanding that there are, of course, continued challenges in terms of ensuring a coherence of service.
Yeah, so I would say that in terms of a couple of examples of initiatives here, it's actually, I was at a table around lunch, and I don't know if Pat Danforth is here, but she mentioned, simple things that just kind of cross-cut. And so we've done, with support from the federal government, we've done a couple of things in BC over the last few years that I think are kind of worth noting. So one is for social assistance, we moved our exemption for earnings to be calculated on an annual basis, which has been a real benefit for people particularly people with episodic disabilities. So they can work more than, now it's $12,000 a year. They can work for a concentrated period of time and not lose their benefits later in the year. And that's something that we worked in close partnership with the disability community to roll out. We also, just a couple of years ago, amended our legislation to take an approach that actually has some roots in Ontario about the social assistance disability income support eligibility criteria, and allowing us to accept other designations that are made for the purposes of disability to be accepted on the same basis as our disability designation. So if you've already gone through an assessment for Canada Pension Plan disability, you don't have to meet our test as well and be adjudicated again. Or if you've already been through an assessment for community living services, you don't have to be adjudicated again. And below that, at the working level between the various government ministries, and when you were speaking earlier, I felt that was a little lived experience of being a provincial civil servant around working with other ministries. And we've have a bit of a history of working together in BC to look at things like different criteria for programs, and to try to maybe not make them the same, but try to align them and come up with a common language. And so we've had some success realigning the criteria so that it is a little more complementary, but I still think if you ask a person who uses the programs, we still have a long way to go, but we have made some progress in that space.
I don't want to be the naysayer on the panel, but I want to talk about accessibility policies. And I think that Canada, provincially and federally, have done a really good job of creating accessibility legislation. And I think that definitely gives us a foundation from which to start. I would like to say, though, from a lived person's experience, and I should back up and say that people with lived experience are a homogenous group. And so, I wouldn't want to sit up here and be arrogant and say I speak for for everybody with a disability. So I actually connected with my network to ask for stories, and which I know I don't have the time to share, but what I do want to share is that the accessibility legislation that we have now, while it's got the scaffolding, it hasn't been built around. And what I mean by that is it doesn't have the bones, it doesn't have the meat, it doesn't have teeth. And in that, there is still and will always be a power differential between employees and those that hire the employees with disabilities. And as it stands, the accessibility legislation, in order for you to get the accessibility requirements that you need, it has to be initiated by the employee. And employees often feel they don't want to speak up because they don't want to jeopardize their job. So there are some significant barriers within that legislation that we need to address before it will be effective in operation. Before I pass it along, I just want to say, in terms of measurable measures and accountability, which is another pillar in the national strategy, I want to commend the CRWDP for having people with lived experience on all the panels today and really embedding them in this conference. And in order for this national strategy to be moved forward and be meaningful, we need to have not just token representation from people with disabilities, but they need to be part of the decision making as well. So, and I see that today in this conference, that's a really good start. So that's all I want to say.
Oh, thank you for that. And just before we move on, I just want to make sure, I don't know if anyone else wanted to add anything in terms of processes within and among governments that need to be put in place to move forward, and on the point of how can perspectives of key stakeholders, and particularly people with lived experience and service providers, be included in that process. Because I think, Pam, some of what you said related to that in terms of the legislation, but I don't know what else people would like to add on that point.
I would just add that from where I stand now, kind of between accessibility legislation and employment programming, is that there's an ongoing interface in BC with the community and people with lived experience for both of those files. We're just getting going on the employment programming side of things, post renegotiation of our agreements, like Epo mentioned. But we do have a long-standing and pretty deep relationship with the disability advocacy community in BC, and so we're planning on moving forward with them leading the way as much as possible.
Okay, thank you. I'm just going to add a few points because I can't resist. In terms of a promising practice, my colleague Henry Kiley spoke on the provincial panels this morning, and I'm not going to repeat what he said about things happening in Newfoundland and Labrador, but we do have a pilot around individualized funding that I see as a promising practice. It's kind of in its infancy, so I wouldn't want to describe it as any more than that. But we've really, some of the things that were mentioned here today, we've really included individuals who might want to avail of individualized funding in the design of that pilot, as well as their support network. So we had design sessions, and people could bring, who they wanted to with them. Potential clients. One of the principles behind it is that no one will be any worse off or have less access to services who agrees to participate in it. And the idea is to increase flexibility so that, if people do work or want to do something different with the funding that they have, they'll have more flexibility in terms of how to use it. So I'm excited about what opportunities that might bring in the future. And we've certainly been looking across the country and listening to people with lived experience and listening to the community in terms of what people want on that. So I do have great optimism around that. So I'm going to hand it over to John now to get his thoughts from a research perspective.
I want you to think of a house and building a house, or building a good wall on a house. And in that wall, there might be bricks, And we know that that if the bricklaying is good and the mortar between the bricks is of high quality and it's built on a solid foundation, we know that then we have a sturdy wall, and we know that when we put up the house, we'll have good walls, and it'll stay up for a long time. And as I've been sitting here listening, I've been thinking about the components, the programs, in other words, that all have to fit together as sort of the bricks. Let me bring that to life a little bit by saying on the income support side, for example, across Canada, we have 10 different programs for income support. I'll just mention them briefly in no particular order. The RDSP, the Canada Workers Benefit with a D on the end that's about to start, the Disability Tax Credit, EI Sickness, CPPD, Social Assistance, Workers' Compensation, Veterans Programs, Workplace Programs in the private sector, and auto insurance disability. That's 10 different systems for income support for people with disability. And then in that 10 different systems, there's 7 different definitions of disability, because the RDSP, the Canada's Workers' Benefits, and the Disability Tax Credit share the same definition, which I don't know if it's a good thing or a bad thing, because it's a very tough definition. So that's 10 of the bricks that's somehow got to be brought together for various different folks. And then I was recently lucky enough to be able to do a study for ESDC on in-kind programs. And we looked at Alberta, and we looked at Ontario, and I don't know, I was surprised by this, but there's 41 different in-kind programs in Ontario. There was 38 in Alberta. So let's say that maybe there's an average that, depending on small or big province, but let's say there's about 40 different programs in each province. We have housing programs, we have legal aid, we have assistive devices programs, we have child care, we have counseling, we have all sorts of different housing supplement programs of various sorts. Some are needs tested, some are income tested, some give you a partial benefit and then stop paying, and then others give a full benefit, again, with various different weird and wonderful tests, some of them transit subsidies of various sorts. So in my mind, these are all the programs, the bricks that are in that wall. And then, to me, as I've listened to the panel, the mortar, what keeps everything together are the various different programs that bring people. So I heard the mentioning, for example, of peer navigators, very, very important part. Who's going to navigate so that everything comes together in a coherent way? Programs for people, I think of one in Toronto called LEAGUE, which is the Lived Experience Advisory Group to the City of Toronto. That's part of what gets you good glue, because that's what gets you where things start to come together when you have that group like that. And Pam has mentioned a couple of instances of that too. I think of programs. The ones I'm familiar with are the ones like Working for Change in Toronto, which actually brings people with disabilities. They've had a number of intakes where they brought them together, and you see people who come into those programs, and unfortunately, a lot of them hate themselves and they hate the people that they've come together with. And what they do is learn together that they're not powerless, and that they can provide good social support to each other. But that takes direction, it takes time, it takes initiative, and it takes good guidance. But what those people become, in some cases, they become human bowling balls. It just, all the barriers in the system, they just knock them over like bowling pins. But then you have others that are not going to be quite that skilled. But once people start to get their voice, once they're actually able to self-advocate, once again, that becomes like to me, I'm thinking of it in this analogy of they become the part of the good mortar in the edifice that we're building. Another I think of the first three rungs of the ladder. We often don't get that right. And just the comment of what you've seen, Terry, in the legal aid system. You see people who are not able, they don't have a smartphone, they don't have a data plan, they don't know how to afford that, they don't have a computer. Sometimes the community hubs are their worst enemy, because you get 10 minutes on the phone and you're not going to get through to Service Canada or Canada Revenue Agency in 10 minutes, and computers that are in libraries are just constantly clogged, and therefore those first three rungs of the ladder you need to even get online those become those real difficulties. But when those things are made available, then you really start to have a chance for these things to come together. So I think we're naive if we think that those 41 in-kind service programs and those 10 different income support programs with the 7 different disability definitions, somehow they're all going to gather together and sing Kumbaya and get together and have a common set of definitions and a common set of services and approaches and philosophies. They're not. So it's everything that everybody's talked about here in terms of those programs that are out there with people with lived experience, that bring those programs together in a coherent way. And so I think that's the best that we can do. We talk about having a basic income, we talk about things like a guaranteed annual income, but we've learned just from aborted experiments that they're very far away. And we know that service integration and that sort of thing takes an awful long time to do. So I think what they've really spoken for today is the whole idea of those programs that bring things together and form the coherent navigation between all those different programs.
Well, thank you, John, and thank you to all the panelists. We really wanted to save lots of time for questions from you today. So I'm going to open it up to the floor and look forward to your questions of this great panel. I'm sure we'll have great answers. I think there's someone coming around with a microphone. Yeah.
Thank you. Thank you for your insights and the panel discussion. I'm probably directing this question more to you, Eppo. You probably won't like the question, but that's okay. When you talked about the new workforce development agreement, it's fairly clear from what we've heard from the panel and from the summary of the provincial strategies in the paper that there is a mishmash of programs, and I think John spoke to that as well. It's a mishmash of programs across the provinces and territories and how they're delivered. The question I have, probably, Eppo, maybe you can, and any of the panelists can answer it, really is, how does the federal government, with the monies, the transfers of monies through the new workforce agreement or with the labour market, the old labour market programs, how are they holding the province's feet to the fire? What do you look at as being a successful outcome? From the monies that are being spent. There are tax dollars that are being spent. Are they being spent well? Well, probably not from province to province. So basically what it is, and I'm asking the question because I don't believe it is well spent. So what are the strings attached, Eppo?
So I guess I would characterize it a little bit differently than necessarily holding their feet to the fire. I think it's very much a partnership between the federal and provincial governments. And through the agreement, we've agreed on a mutual set of governance, like a governance system and a number of controls for the agreements. I think other than sort of the standard reporting requirements that you would expect through, annual reports and financial statements and all of that stuff, I think one of the things that's really, where I think we really made some great progress with these agreements is that we've created a very robust performance measurement strategy. And this performance measurement strategy is not only for the workforce development agreements, but it's also aligned with a much bigger transfer called the labor market development agreements, which has been in place for around 20 years now with provinces and territories. And through the collection of quite a bit of information, including individual information of people who are going through the programs, including the collection of social insurance numbers, we're able to under the labor market development agreements to really track the progress and the effectiveness of money spent on individual programs. And that's now something that we've been able to carry forward into the workforce development agreements. So there is a much greater emphasis and a much better ability under the workforce development agreements to actually measure the impacts of programming and to really test, what's working and what are the outcomes in terms of their ability to increase specific employment outcomes. And also increases to income, for example. We're also working with a number of provinces and territories to start to measure other things that go beyond income and employment, because I think for many people, particularly those who are further removed from the labor market, there's also success is not necessarily a job in the first instance. Success may follow along a continuum where there's a number of steps that need to take place before getting that job and being able to earn that income and becoming independent. So for some, just being able to complete a training program is a matter of success, or there may be some other some other skills or steps along the way. So we're looking at measuring that as well. So there is quite a bit of emphasis there. So while I think one of the benefits to these agreements is that they do provide a lot more flexibility and more money to provinces and territories, they also provide us with more tools to measure the success of the programs over time.
Just to add to that briefly, and Eppo, it's nice of you to say that you're not holding our feet to the fire. We feel a little bit differently in the provinces, but I would say that the performance measurement strategy is a bit of I'll use the word sleeper, but it was a pretty significant shift in those agreements, particularly on the disability side, and it's having the intended effect. And this is live reporting of the province to the federal government, but it's having it's making the provinces, and I know from BC's experience, look at the suite of programs it's funding and work more in depth with service providers on what we do record, and being more deliberate and intentional about trying to get granular data and working on the qualitative and quantitative aspects of that. So I do think that's it'll take time for us to see what the results are and then adjust investments, but it's something that I think is important in those agreements and will bear fruit over time.
I'm a bit worried about the word outcome-based because we know to date that for people with mental illness, for example, people with the most complex barriers to employment, outcome-based means that they don't get a chance to show employers what they can do because service providers are so overworked and fraught with having to meet performance targets that they pick the low-hanging fruit. They get the people that they know they can get their numbers up with. And that's not a criticism of service providers, it's just a fact of the funding model. And so I'd like us to consider what we mean by outcome-based model or outcome-based measures, and maybe reframe that and take into consideration that it needs to move away from counting placements and actually getting all people, into good quality jobs that are attainable and sustainable.
And I would just add, I think that's a really good point. And again, one of the things that we've tried to sort of work into the workforce development agreements is the opportunity to be looking at those outcomes that are not simply job-based or income outcomes, whether that's looking at resilience, trying to find objective and useful ways to measure that, or self-reliance or other things, but to understand that that is something that's key in this continuum of moving towards employment and exploring, and with a commitment to look at that, exploring what the best ways to sort of measure and assess that might be.
Anyone, John, did you want to comment on that, or?
When looking at various programs across the country, whether we're looking at income support services, all those programs, trying to bring them together, and those examples I think that were given earlier, just like a social assistance program uses a CPP definition and therefore doesn't put somebody through the whole process again. Those are those. I think of bringing programs together somewhat in the same sense as I think of particle physics. The commonalities between programs, especially when they have very, very different definitions. They define dependent differently, they define spouse differently, they define income differently, they define gross and net differently. Trying to get to that base amount where you can actually start to simplify programs and bring them together is very, very difficult. But I think I'd be remiss if I didn't comment as follows. Having been on Minister Duclos' advisory committee on poverty reduction, and I think we did, it's really, although there was no new spending with it, you have an official poverty line for the first time in 151 years since Confederation. We have a target of 20% poverty reduction by 2020, and then a 50% poverty reduction by 2030. And an advisory council that's going to have people with lived experience, and we're going to have that in legislation. I think that in that 2020 to 2030 period, when we make that first step, which will largely be done with kids because of the child benefit, and maybe a few working people through the Canada Workers Benefit, and then mostly for seniors with increases in GIS to take them out of poverty. I think that really the decade between 2020 and 2030 is really the decade where we talk about people with disabilities. Why? Because we tend to use we use a swimming pool analogy when we talk about poverty. We talk about the shallow end and we talk about the deep end. And a lot of kids and people, especially seniors, are in what we call shallow poverty, and it's going to be easier to get them there with the 2020 target. But I think one thing that second target can really do is start to galvanize us, because in many ways we're talking about people with disabilities who do continue to live in poverty, and the programs that we're talking about, getting them back to work, getting them into work, into meaningful training, into meaningful careers even, that we talked about in a previous session, is what we're going to have to be talking over that decade. And I think there's a way in which the Bill 87, C87, and once it's passed, can really be, if we breathe life into it, can be a guiding light in terms of focusing all Canadians on the next stage, which I think is people with disabilities, and taking them out of poverty, and the various different ways that we're going to do that. And of course, employment and education, training and career building is going to be a big part of that. So I think that can be a galvanizing force in this.
Well, thank you. I think we're ready for the next question.
Hi. Just to complicate things a little bit, what I'm concerned about is we have an aging work population, and I think that we have a growing, we have a much bigger problem of potential people with disabilities that are already working. When we look at the aging and the increase of chronic disease, cancer survivor rates, where people have had to go off work for a period of time. And I'm just wondering, has there been provincial and federal discussion around how we can provide employer supports for people with episodic conditions, but particularly the notion of aging populations in relationship to CPP, income support, or support for employers?
Who wants to tackle that one?
Well, maybe just to say that that I think that's definitely something that's on the radar federally, as I'm sure it is in many provinces and territories. And the House of Commons, of course, their HUMA committee has been studying the issue, and I know it's sort of top of mind as well among federal ministers. In terms of our programs, of course, our programs are people with episodic disabilities are entirely eligible for our programs, and so service deliverers who are delivering services for individuals with episodic disabilities can receive support and funding through, for example, the Opportunities Fund, and also through the monies that are flowing through the workforce development agreements. There's also obviously a big part to play in that whole system in terms of income support. So whether it's through the EI system or other income support programs established specifically for persons with disabilities. So maybe that's not a very concrete answer, but to say that there are opportunities under the current system to address this, and it's very much something that is front and center.
You mentioned CPP. Unfortunately, CPP and episodic disabilities don't really mesh very well because one of the criteria for getting CPP disability is your disability has to be prolonged, which is likely to result in death or of indefinite duration. And it also has to regularly prevent you from engaging in substantially gainful occupation. I just love CPP for its clarity of definition of terms. That's one thing which I think in terms of navigation of programs, please use plain language. But it also in terms of the interface between work and CPP disability, they are looking at that. There is a round table of clients and stakeholders meeting with senior bureaucrats from both ESDC and Service Canada looking at various aspects of CPP, and one is the return to work aspect. And the thing is, you can return to work on CPP, you can earn a bit of money, basically the amount of the minimal amount of contributions for CPP before they will then look at whether or not you can continue on the system. But there is also a completely different amount, which is a definition in the regulations for substantially gainful, which is amount equal to the maximum CPP disability pension. There's some things. The difficulty with CPP also in terms of any kind of improved benefits is the feds can't change that unilaterally. They need to have the provinces on board and approval from the majority of the provinces. I believe it's with at least 2/3 of the population. And it's further made difficult by the fact that Quebec isn't part of the CPP, they're part of the QPP. So you know, changes to CPP are really, really difficult to foresee if it's talking about increased benefits or changing the benefit structure.
I have a question for you. You all talked about the lack of harmonization of employment programs at varying levels of the government, and even, you know, sometimes in terms of provinces, in terms of employment programs that are funded by different departments of the province, and the need to have navigators. I know that I run an agency in Ottawa, and we have a navigator in our own program to help our clients navigate our own programs because they come from a multiple of funders, which is ludicrous. But so my question really to the panel, and this also plays to how can you have data that's of any value when all these programs are different, so it becomes comparing apples to oranges. What's the point of having all this evidence-based knowledge on supported employment programs that's been gathered for decades, and yet funders at every level of government chooses not to implement these programs as the evidence-based data indicates they should be applied? So I'll throw that out there because I know the feds in particular put a lot of money into research. God knows where it goes.
I'll try to take a stab. I'd say it just point taken. There's a lot of evidence already out there on supportive employment, and I'm going to play the new guy card in that I'm coming from. I worked for a long time on the social assistance side of things, and I'm coming into the employment side of things. And one of my early observations is that it's a pretty fragmented sector in terms of approaches. A lot of we're kind of in a moment in time where we're the primary focus of a lot of our service providers, at least in BC, is to provide short-term assistance to people who are on employment insurance, and to work with them to get them back into work. And that framework wasn't really designed from the perspective that 20 to 25% of the population has a disability. And so I think we're in the midst of a fairly significant shift in philosophy from government through down to service provider on what the most effective interventions are. And I'm hearing repeatedly through these rooms and different tables that it makes a lot more sense to take a supported employment approach to all aspects of employment service because it works for everybody, as opposed to just doing it for small target populations. But I do think that there is, what I hear a lot from the service providers that I've been engaging with over the last few months, is there's still a bit of a concept of employment readiness built into the philosophy that we need to kind of fix people or address the medical, and I'm using air quotes, issues before we begin to place and support that person. And I think that that's an area that is going to take some philosophical shifting throughout the governments and the service provider community as well.
John wants to say something earlier as well.
Yeah, just talking about the various programs and why we still have the same programs we do. I think it's really important to note that employment insurance started out as unemployment insurance through a constitutional amendment in 1940, and then we got pension programs like CPP in 1951 as part of the constitutional amendment on pensions, and then 1964 with survivors within CPP. All of that is to say that we've had successive prime ministers since Jean Chrétien, who said they weren't going to touch the Constitution. And Mr. Trudeau has said the same thing. As a result, those programs are going to be around for a while, and they're going to stay in many ways the way they are. So going back to my analogy of the bricks and the mortar, I would say that there's a lot more that we can do with the mortar, the wraparound services, the Pure Navigator, the trying to make sure that the programs work within themselves and we have a coherent framework, because I think the programs themselves, you're right, they have different philosophies. I mean, social insurance, the philosophy behind social insurance as it relates to disability in CPP is that disability is a hazard. And so we're insuring against the hazard of disability. So it's going to have that employment-based definition, whereas social assistance is going to have a condition-based definition. They're entirely different. The philosophy is entirely different. So it's important to say, okay, if that's what we got, we have to build around it, and we have you know, you can take that approach, as I said, that you can have people, you can help train people to become human bowling balls that overcome all the barriers. I've seen that, and I've seen it work, and I've seen people come together and with the peer navigation and really make things work over a period of time. But the one other point that I would make as part of this is that for so long now, our employment programs, our job programs have been based on a competitive model. And they compete with each other for contracts, and they compete with each other for the lowest price to put the most people into employment. And I think that sports teams ought to compete, and that employment programs ought to collaborate. And I think if we brought in a collaboration model rather than a competitive model, we'd be doing a lot better for our clients.
Anyone else want to comment before we can take another question then?
Actually, I got a comment and a question. The first comment has to do with the very appropriate comment you made about hazards. If there's a hazard and if there's some liability that can be proved, people with disabilities, not always, but they tend to do okay. So if we look at automobile insurance, if we look at victims of criminal violence, we go down a list of stuff, then people end up with decent incomes and they're able to function if they can get through all the hoops and go through all the stuff of going through a court system, the litigation stuff and falling on, you know, people's walks is a good example of that. If they can't, then there's a second tier, which is less adequate. And that's the stuff that we're talking about now, is people who need support and they can't find anybody to blame for it, so there's no liability there. And that's a major problem in our system, that dichotomy. And commenting on that dichotomy would be one thing, but then I wanted to talk about something else, and that's record keeping. I used to read LMAPD reports all the time, okay? And they're dreadful. They were dreadful. They were inconsistent. One province did one thing, one province did another thing. There were issues with record keeping between the provinces and the caregivers. There was no consistency. And nobody seemed to be working on, well, people tried, but they didn't do a very good job. But there's a parallel system over among Indigenous peoples. Indigenous peoples got together with the Assets Program, and the Assets Program requires consistent record keeping. We had to teach people how to do it, but they learned and they're good at it. And as a result of that, we could actually look at what happened over the long term. And I saw within the Assets Program that it made a significant enough impact. That training that Indigenous people got in their 20s and 30s had enough of an impact so that you could see over time in the census that there were increases in labor force participation and people were doing better. I don't understand why it is over 25 years or 30 years with the LMAPDs going back to with the workplace agreement things, the provinces can sit down and they have to some degree, and the service providers can sit down, put together consistent data so we can look at things longitudinally to see if an intervention really has an outcome, has outcomes in the short run and in the long run. We've done little bits of that. Evaluation has done that a little bit at ESDCs, but it's not consistent. It's not across the board, and we need to go somewhere to allow that to happen. And I'd like to hear from you how it is that you're working with the federal government and with your service providers to provide that consistent information so we can actually see some outcomes.
So I'll just elaborate on some of my earlier comments. So when we signed the new workforce development agreement, we signed on to providing a whole raft of data that we've never provided before through the LMAPD. So once we have, I think it's 2019 is when that requirement kicks in, and as we speak, there are people working across the country to develop the systems and processes in place to start reporting out on that. I can't speak for the last 25 years, but I have been involved on that in the last 10, and I've observed the hodgepodge nature of reporting has been dreadful, quite honestly, and so you raise a really good point about that, and I think that's why, as I mentioned, it's a bit of a sleeper, because other than you and I, not many people read LMAPD reports, but it might be time to start reading them as we get some consistent and comparable information from across the country about what's working, and I fully expect for the province of BC to find out some things aren't working, and to have some really, difficult conversations with service providers and with clients and organizations around how we redesign the programs so that they are effective. But it's not an easy one, and not a task that we would ever take very lightly, because a lot of these programs have, and this is a theme of this panel here, have these historical roots and they serve a need, and sometimes it's purely a social need rather than an employment need, and that's good. That's a good thing, and we should find a way to make sure that there's continuity there without. But we begin to reprofile the money that's meant for employment outcomes towards employment outcomes. So,
If I can just just underline just something that you mentioned, Ian, is that, of course, this performance measurement strategy is a multilateral strategy. So it's not just that BC signed on to this, but every province and territory that we've concluded the agreements with has signed on to it. And it was a multilateral process. So all of the provinces and territories sat down with the federal government, and we agreed to this as a group. So there's going to be a lot more consistency and a lot more rigor in the measurement of the outcomes of these agreements going forward.
We're actually out of time. Thank you to my timer, because excellent questions. I thank all of you for your very active participation. I want to thank all the panelists for their comments today and for their ability to answer your challenging questions and very important questions. And also to Mary Reid, who's taking notes there and is going to be reporting back on the session. So thank you to everyone.